Hi, it's Sean Nynan from Leeds Frailty Education. What is the best screening tool for delirium? Well, it's the 4AT. This is recommended by NICE and can be performed by any health or social care professional. It takes less than 2 minutes to do, doesn't require any specific training, and is now available as an app. The 4AT stands for the 4 A's. The first A is a test of alertness. If the patient is obviously drowsy or obviously hyperactive, they score 4. If they are normal and alert, they score 0. You're allowed to be asleep as long as you're easily roused. The second A is the AMT4. Here you ask people their age, date of birth, year and place. If they get everything right, they score 0. If they make one mistake, they score 1. And if they make 2 or more mistakes, they score 2. If you can't answer these questions because you can't follow what's going on or you're drowsy, you score 2. The third A is a test of attention. Here you ask the person to say what are the months of the year backwards, starting from December. You're allowed to give them one prompt. What is the month before December? If they get to June, they pass and they score 0. If they make one mistake or more mistakes, or they refuse to start, they'd score 1. Again, if they can't follow what you're saying, then they'd score 2. And they might not follow you because they're drowsy or they just can't understand what you're saying. The last A is, has there been an acute change happening in the last 2 weeks, still evident in the last 24 hours? You might know this to yourself if you know the person well. If not, you can look to other sources. For example, if somebody's come into the A&E department because of acute confusion, you'd score yes to that. And if somebody normally lives alone and independently and you find them drowsy, you'd score yes again. The mistakes people make on the 4AT is thinking that you can't score them if people can't talk to you. You can. If people don't speak English, then get an interpreter. If they can't hear you, get hearing aids. We wouldn't do a 4AT if somebody is in a comatose state, in a permanent coma. But for all other people, we can do the 4AT. A very good and simple test for delirium.